Should everyone be taking colchicine in order to prevent heart attacks? That's the kind of question we see answered in the January 2022 CFP journal. And here at CFP Distilled every month, we take a look for those pearls, things that you need to know if you're studying for the CCFP exam or for clinical practice in family medicine in Canada. So in addition to that, we've got guideline updates this month. We've also got some articles on COVID-19 induced vaccine injury in children, specifically myocarditis. So let's take a closer look. Does colchicine prevent heart attacks? Well, the answer is yes, but there's always a condition. So what are the conditions? Well, first of all, the studies are talking about folks who have coronary artery disease. We're talking about secondary prevention. Also, the studies show that there's about a 1% risk in reduction of cardiac events. We're talking myocardial infarction and the like. But there's also side effects. That's 2% of people are going to have gastrointestinal side effects. And what's the mortality benefit, you may ask? There isn't any.
Rapid recommendations from 2020 from Danielle O'Toole. So this is part 2. Where are we going to concentrate? We're going to talk about the lung. So a combination treatment of ICS and formoterol for both prevention and controller therapy for patients over the age of 4 years old for asthma. What else are we going to do? We're going to remember that glucocorticoids and antihistamines are no longer a part of the treatment for anaphylaxis.
So a child comes to your clinic, they've just had the COVID-19 vaccine. They're complaining about chest pain, shortness of breath on exertion, or palpitations. What do you need to think about? That's right, we're thinking about vaccine-induced myocarditis. It's rare, it's nowhere near as common as in people who do get COVID-19, but it's something we need to consider. What are your next steps? History, physical, and they're gonna need an ECG and a troponin to rule out myocarditis, so make sure you send them on to the emergency room so that they can get those done today.
What are the other key recommendations in the second half of this part 2 article from top recommendations in 2020? It's to go with the mind. So the first thing is, what if you have a patient and you discover covert infarcts on imaging? Well, you can consider a recommendation for ASA in those patients. Now, what about that workup for mild cognitive impairment or dementia? Things that we want to ensure we check. We want to check hearing. We want to check, are they sleeping well? Is there insomnia? And is there frailty involved, neuropsychiatric symptoms, and gait speed? We want to check all those. What about patients who've already been started on memantine or cholinesterase inhibitors? When use exceeds 12 months and cognitive decline has been going on for 6 months, consider stopping those medications.
Thanks for watching the January 2022 CFP Distilled. My name is Dr. Simon Moore. Now, if you're studying for the CCFP exam, please take a look at the reviewcourse.com where we've compiled all of our best tips and tricks to help you prepare for the exam. Hope to see you again next month in February 2022.